You close your eyes in the operating room and wake up hours later with surgery complete. But what actually happens to your brain and body during anesthesia is far stranger and more dangerous than the peaceful sleep you imagine. Let's start with what anesthesia actually is, because it's not sleep. When you're asleep, your brain cycles through different stages. You can be woken up. You're breathing on your own. Anesthesia is completely different. It's a drug-induced reversible coma. Your brain is suppressed to the point where you're unconscious, immobile, and unaware. You're not sleeping. You're as close to dead as you can be while still being alive. Here's what's happening to your brain. Anesthesia drugs disrupt communication between neurons. Your brain cells can't talk to each other properly. The areas responsible for consciousness, memory formation, and pain perception shut down. Different anesthetics work on different brain receptors, but the result is the same. Your consciousness disappears. Now let's talk about the cocktail of drugs you actually receive. General anesthesia isn't one drug. It's typically 3 or 4 working together. You get an induction agent to knock you out quickly. Propofol is most common, the milky white liquid that Michael Jackson died from. You get an opioid for pain control. Fentanyl is typical. You get a paralytic to stop you from moving, rocuronium or vecuronium. And you get inhaled anesthetic gases to keep you unconscious, sevoflurane or desflurane. Here's what people don't realize. These drugs are given in precise doses calculated by your weight, age, health status, and the procedure. Too little, and you wake up during surgery. Too much, and you might not wake up at all. Anesthesiologists are managing a razor's edge between unconsciousness and death. If you're learning what really happens when you go under, hit subscribe. We're revealing the reality of anesthesia that most patients never hear about. Let's talk about what happens in the minutes before you go under. You're wheeled into the operating room. It's cold, kept at 65 to 68 degrees Fahrenheit to reduce infection risk. You're moved onto the operating table. Monitors are attached, EKG for heart rhythm, blood pressure cuff, pulse oximeter for oxygen levels. Here's the sequence. The anesthesiologist gives you something to relax, usually midazolam, a sedative that causes amnesia. Then comes the induction agent. With propofol, you'll feel a cold sensation traveling up your arm, sometimes burning, and within seconds, you're gone. Consciousness doesn't fade gradually. It disappears instantly, like someone flipped a switch. Now let's talk about what happens during those seconds you're losing consciousness. Your brain doesn't shut down all at once. Different areas go offline in sequence. First, you lose your sense of time and place. Then your ability to form memories disappears. Then your awareness of surroundings vanishes. Finally, consciousness itself blinks out. The entire process takes 10 to 20 seconds. Here's what's happening to your body once you're unconscious. The paralytic kicks in. Your muscles stop working. You stop breathing. This is intentional. The surgical team needs you completely still. A tube is inserted down your throat into your windpipe. Intubation. You're connected to a ventilator that breathes for you. You have zero control over your own breathing until the drugs wear off. Now let's talk about how you're kept unconscious during surgery. The anesthesiologist continuously adjusts drug doses based on your vital signs. They're watching heart rate, blood pressure, oxygen levels, and sometimes brainwave monitors. If your heart rate or blood pressure spikes, it might mean you're too light, so they increase the dose. If your vital signs drop too low, they decrease the dose. It's a constant balancing act. Here's what's terrifying. The anesthesiologist is managing your life support systems manually. Your breathing is controlled by a machine they're adjusting. Your blood pressure is maintained with fluids and sometimes medications. You're completely dependent on their expertise and vigilance. This is why anesthesiologists have the highest malpractice insurance. The margin for error is razor thin. Let's talk about what you don't feel during surgery. The paralytic stops you from moving, but it doesn't stop pain or create unconsciousness. The anesthetic stops consciousness, but doesn't always stop pain signals. That's why opioids are given separately to block pain. These 3 components, unconsciousness, paralysis, and pain control, are managed independently. If this is revealing how complex anesthesia actually is, make sure you're subscribed. We're exposing the risks and realities that most patients never consider. Here's what can go wrong. Malignant hyperthermia. a genetic condition where anesthesia triggers uncontrolled muscle contractions and dangerously high body temperature. Aspiration. If you ate before surgery, stomach contents can enter your lungs, causing pneumonia or death. Anaphylaxis. Severe allergic reactions causing life-threatening blood pressure drops. Awareness. Waking up during surgery while paralyzed, and simply not waking up. Though rare, some patients never regain consciousness. Now let's talk about waking up, because it's not like waking from sleep. As surgery ends, the anesthesiologist stops giving anesthetic drugs. The paralytics are reversed. Inhaled anesthetics are exhaled as you breathe. The drugs clear from your system gradually, but you don't wake up all at once. Here's the sequence in reverse. First, basic brainstem functions return. Breathing reflex comes back, so the ventilator tube can be removed. Then, you start responding to stimuli, moving in response to pain or commands, but not consciously. Then, consciousness begins returning, but you're confused, disoriented, with no idea where you are. Finally, full awareness returns, though you'll be groggy for hours. Let's talk about emergence delirium, waking up agitated, confused, combative, or terrified. This happens to some people, especially children and elderly patients. You might wake up fighting, screaming, trying to pull out IVs, completely disoriented. The medical team restrains you and gives sedatives until you calm down. You usually don't remember it. Here's what happens in recovery. You're taken to the PACU, post-anesthesia care unit. Nurses monitor you closely as drugs wear off. You'll be drowsy, possibly nauseous, definitely disoriented. You stay in PACU until you're stable, breathing independently, awake enough, pain controlled, vital signs stable. Now let's talk about anesthesia's effects on memory and cognition. Many patients report post-operative cognitive dysfunction, memory problems, difficulty concentrating, mental fog. In elderly patients, this can be severe and permanent. Studies show that anesthesia and surgery together can accelerate cognitive decline and potentially increase dementia risk. Here's something they don't tell you. Anesthesia is cumulative. Each time you go under, you're exposing your brain to drugs that suppress neural activity. For elderly patients having multiple surgeries, each anesthetic exposure might contribute to cognitive decline. Let's talk about why anesthesia is actually remarkable despite the risks. Modern anesthesia allows surgeries that would be impossible otherwise: open heart surgery, brain surgery, organ transplants. The death rate from anesthesia alone is now about 1 in 100,000 to 1 in 200,000. Remarkably safe, given that you're essentially being temporarily killed and brought back. Here's the philosophical mystery. Nobody knows exactly how anesthesia creates unconsciousness. We know which receptors the drugs bind to. We know how they affect neurotransmitters, but we don't understand how disrupting neural communication eliminates consciousness. What is consciousness? Where does it go during anesthesia? These are questions science still can't fully answer. What really happens when you go under anesthesia is that you're chemically transformed from a conscious, breathing, functioning person into an unconscious, paralyzed body kept alive by machines and an anesthesiologist's skill. It's controlled, reversible, and usually safe, but it's also profound, risky, and not fully understood. The next time you're told you'll be put to sleep for surgery, remember, you won't be sleeping. You'll be in a drug-induced coma, completely dependent on medical technology and human expertise to bring you back. It's one of medicine's greatest achievements and strangest experiences: the temporary obliteration and restoration of consciousness itself.